This is Bloomberg Law with June Grasso from Bloomberg Radio.
I do believe that autism does come from vaccines. There's no vaccine that is, safe and effective.
Robert F. Kennedy Jr. has spent decades spreading his anti-vax beliefs, and his debunked theory that vaccines cause autism is just one of the dizzying number of health conspiracy theories he's advanced over the years. Some others, that chemicals in the water can cause children to turn transgender, that school shootings are caused by antidepressants, that Wi-Fi causes cancer, and that AIDS is not caused by HIV. And President-elect Donald Trump has picked Kennedy to control the world's largest public health agency as Health and Human Services Secretary.
We want you to come up with things and ideas and what you've been talking about for a long time, and I think you're going to do some unbelievable thing. Nobody's going to be able to do it like you.
And that's just what health experts are afraid of, that Kennedy will be able to do some unbelievable things detrimental to the health of Americans, by making good on his promises that are based on junk science and debunked theories. If confirmed, Kennedy will control an agency with a massive reach, from providing health insurance for nearly half the country, to overseeing research of vaccines, diseases, and cures, to regulating the medications found in our medicine cabinets, and inspecting the foods that end up in our cupboards. Joining me is healthcare attorney Harry Nelson of Leech Tishman Nelson Hardiman. Harry, just how much power does the Health and Human Services Secretary have?
So, as Secretary of Health and Human Services, RFK would actually oversee a whole series of federal agencies that are health-related, the primary ones being the Food and Drug Administration, the FDA as part of Health and Human Services, before National Institute of Health and Center for Disease Control, and also the Center for Medicare and Medicaid Services, CMS, which regulates most federal spending. He also would oversee a whole series of federal funding to clinics under various other federal health programs for family planning and a whole series of other things that are kind of adjacent to these two major agencies.
It's hard to know where to start because he has advanced so many conspiracy theories related to health over the years. Let's start with vaccines because he's one of the most famous anti-vaxxers in the country. And he said just in July, there's no vaccine that is safe and effective. He's repeatedly said that vaccines cause autism. He's also said recently that he won't take vaccines away from Americans. But what can he do?
Health and Human Services really is the federal agency that manages public trust in vaccine programs. It's responsible for vaccine rollouts. There's also the National Institute of Health and Center for Disease Control, kind of these key federal agencies that are really responsible for putting out good information about vaccines. And so the idea that someone who has been an active proponent of vaccine misinformation, is going to be in charge is a little shocking. And certainly the ability of his expressed beliefs to become part of federal policy or to at least interfere with getting vaccines out there, potentially with funding for vaccines and for just sort of distribution, is somewhat terrifying.
Are any of his theories about vaccines, are any of them based in reality?
I mean, I haven't studied every single thing he said, but it's clear
hard
that
to keep track of that.
Been very public about some very active misinformation. And it just seems to me that he has such a complete distrust for pharma. Certainly, I don't think we should just say that the pharmaceutical industries are perfect, but he has allowed that broad distrust he has for everything about the pharmaceutical industry to basically lead him to the belief that vaccines are just essentially some kind of a racket that are actually causing problems in the world. And it's a crazy position. It's not a position that is defensible by reference to any evidence.
I mean, with vaccine rates slipping, haven't we seen some outbreaks of measles and other diseases that had previously been stamped out?
Well, yeah, we've seen that. We've seen actually, a return of all kinds of diseases that had largely been suppressed and eradicated are coming back. Measles is a good example. There's no question that vaccine usage overall in the United States is down, that more and more parents are choosing not to vaccinate their kids. He's been a persistent promoter of this debunked theory that vaccines are linked to autism. particularly like the chemical thimerosal. And so there's no question that he's causing the anti-vax position to seem to have credibility in the public mind, even though it has absolutely no evidence and has been thoroughly debunked.
So even though he says he's not going to take vaccines away, the co-chair of Trump's transition team recently said Kennedy wanted to access federal health data with the goal of proving vaccines are unsafe and pulling them from the market. What would he have to do to undo the approval of an already approved vaccine?
I think it's not going to be an easy path for him to disrupt approval of vaccines or, frankly, any drugs. He can certainly, install leadership and convene task forces that are sort of tasked with exploring, fraud or exploring problems with vaccines. But there is actually, thankfully, a process of review at the FDA that will be dragged out and will not allow for this decision to be made quickly. There would have to be presentation of evidence. So I think he can start this and he can generate a lot of headlines for it, but I actually have trouble believing that he'll actually be able to advance the process, at least based on what we know now about vaccines and the extent to which they have been, positively transformative of public health in nearly every case.
Don't drug makers also have a lot of influence in Congress with the money they've spent?
Yeah, I think it was very interesting. RFK put out a couple of weeks before the election a sort of statement to pharmaceutical industry and to anyone who's lobbied for them that they should watch out, they should save their records, and they should know he would be coming for them if Trump won. So it certainly is not a good time to be a pharmaceutical lobbyist, at least from the standpoint of an RFK-led FDA. But there's no question that the pharmaceutical industry is one of, if not the most powerful lobby. And we've seen the way that the United States has protected inflated pricing, for example, for pharmaceuticals, even as prices are lower throughout the rest of the world, by limiting the ability of the government to negotiate prices. That's just one example. We've seen a very cozy relationship between the federal government and the pharmaceutical industry for the most part. And I do think that this signals a new shift. All you have to do is watch the stock prices of pharmaceuticals, and you can see a lot of people are worried.
So over the weekend at an event, Kennedy said, on January 21st, 600 people are going to walk into the offices at NIH, and 600 people are going to leave. Can he just wholesale fire 600 people?
So there's a distinction in the agencies between people who hold political positions that are recognized to be specific political appointments and then the long-time sort of staff at lower levels. So, yeah, this business that he talked about firing 600 people at the National Institute of Health and replacing with new people, it seems excessive. Clearly, the Trump administration and under Kennedy's leadership could absolutely replace all the political appointments. And I don't know the exact number, but I suspect those are in the dozens, but not in the hundreds. And that the real question will be whether agency staff further down below in non-political roles, are going to want to be around and be part of an administration and are going to stick around to resist what's going to happen, or whether they're just going to think the time is right to get out. But I don't think he can do this unilaterally.
After vaccines, another one of Kennedy's big targets is getting rid of fluoride in the water. There's been fluoride in the water in the U.S. since 1945. So explain what it does.
For decades and decades, we've had fluoride in the water to promote dental health. Like, it's been seen as something that an essential kind of way to change dental health, to make children's teeth stronger. It's always been seen as something that was a positive sign and a sign of advanced development. RFK has now been making arguments, again, without evidence, that fluoride in the water is causing arthritis, is causing bone cancer, is causing neurodevelopmental disorders. He has all kinds of theories, which, again, are unproven. Generally, fluoride in the water has been seen as a sort of prophylactic way to get American kids to make sure their teeth are strong, prevent tooth decay. And the idea that it has all these secondary effects is really, it's part of this whole unproven area of medicine where there are plenty of theories. You can always find a doctor, an alternative medicine approach that will, argue that that's actually the problem, but there's no support for it whatsoever. So he is going to have enormous power through CDC. Whether he's actually going to be able to, single-handedly have fluoride removed from the public water is unlikely. I think there's too many state public health authorities And this is such an established part of U.S. public water supply policy that it's hard to imagine he's actually going to do anything here other than certainly erode public support for something that's been uncontroversial.
He wrote on social media, on January 20th, the Trump White House will advise all U.S. water systems to remove fluoride from public water. But it's the states, right, who have control over the fluoride in the water.
Exactly. It's public health authorities at the state level. So his ability to remove fluoride from all these locally regulated water systems is extremely limited. The only power that he really has with the Center for Disease Control and to the extent that his policies are shared by any allies at the EPA is to really change policy on this issue in terms of setting standards, for example, for what are safe fluoride levels. But again, this is one of those areas where, fluoride has been widely embraced by all public health organizations as having enormous benefits in preventing tooth decay. If you go back to the pre-fluoride era of the kind of dental problems that people had, it becomes very clear why this was really a transformative in terms of improving dental health. So it's hard to believe. He may undermine public support for it. He could try to, if he really was successful, he could sort of try to change some federal standards on this. But as a practical matter, most states and counties and other local authorities are going to probably stand pat, and we're not going to see any change in the fluoride in U.S. water.
Coming up next on the Bloomberg Law Show, I'll continue this conversation with healthcare attorney Harry Nelson. What about Robert Kennedy's Make America Healthy Again movement? I'm June Grasso, and you're listening to Bloomberg. President-elect Donald Trump is tapping Robert F. Kennedy Jr. to run the Department of Health and Human Services, a move that would elevate a prominent vaccine skeptic and pharmaceutical industry critic to the top role on federal health policy. Kennedy has advanced a host of unorthodox views on public health, most notably questioning the safety and efficacy of vaccines. During the COVID-19 pandemic, he called the shots a crime against humanity and compared them to the Nazi Holocaust.
They're going to have the right to compel unwanted medical interventions on us. The Nazis did that in the camps.
I've been talking to healthcare attorney Harry Nelson. Harry, Kennedy's been making a lot of threats. He's also threatened to throw out entire departments of the FDA.
So FDA is within Health and Human Services, so he will have significant control and the ability to appoint leadership there. There's a lot of really interesting questions. The one that interests me the most is actually, the issue of mifepristone. Ordinarily, we have seen that historically drug policy, which drugs get approved, has not been a politicized process, but the exception has been the abortion drug, mifepristone, which is now being used in the vast majority of abortions in the U.S. and has been distributed since the first Trump administration and early Biden administration, has been distributed by telemedicine, creating a new level of privacy and access. So there was an effort to try to block it, and the Supreme Court turned it away, was not interested in interfering with the FDA. But now the question becomes, can an RFK-led FDA actually begin an effort to restrict access? So that's a really important question. And also, to me, the question that's really interesting is the extent to which RFK's own positions on abortion seem to be much, much more open and permissive in contrast to some of the other people around President Trump. So who's going to control that process of appointments is super interesting. And I do think we're going to see potentially a newly politicized process, certainly on this drug and possibly on others. One thing that's really, really interesting is peptides and stem cells and other kinds of therapies that are also under FDA that are currently very restricted. We've seen, by the way, the number one weight loss drug in America these days, Ozempic, Wegovy, Mounjaro, whatever you want to call it, is the Eli Lilly and Novo Nordisk versions of peptides, which are strings of amino acid in the human body. And the FDA has not allowed, under its existing rules, peptides to be distributed legally unless they go through very, very expensive drug approval. So RFK, one of the more interesting parts of his policy to me is his threat to open up peptides, to open up greater stem cell therapies. These are areas where there's a lot of controversy, again, about how effective these things are. There seems to be a significant amount of pent-up public demand for drugs. And it's also a really interesting area to watch on federal policy. It's one of those areas where there clearly are things being distributed in like the alternative medicine community, in longevity medicine, for example, that are kind of not legal at the moment, that could become much more widely available. So a really interesting area to watch.
What happens to the National Institutes of Health under RFK? When he was running for president, he said he'd tell the NIH to pause drug development and infectious research disease for 8 years and instead focus on chronic diseases. And among the advances that were supported by money from NIH are a medication for opioid addiction, a vaccine to prevent cervical cancer, and many new cancer drugs. Kennedy has criticized NIH for not doing enough to study the role of vaccines in autism.
So it's terrifying that he, is talking about potentially limiting ongoing funding of clinical research for drugs. We are on the precipice of, because of the funding of the National Institute of Health in supporting clinical trials, making funding available, we're on the precipice of all kinds of really incredible. In my practice, I hear, just little pieces of the puzzle, but new cancer drugs, for example, that are in development and coming on the market. So he has enormous power over the National Institute of Health. That is the primary channel of how funding occurs for pharmaceutical research. And, doctors around the country and around the world are really, getting their research funded through this agency. So his ability to stop that funding is a little bit scary. The National Institute of Health is actually, I think it's something like 25 to 30 different actual institutes and centers working on different health issues. And his ability to shift the priorities entirely from, again, what has been a really, until now, apolitical process of just really trying to support good science is scary. It's hard to see where the funding would be picked up if NIH funding was really cut in the way that he is talking about.
You've said scary and terrifying a couple of times. What do you think is the worst possible thing that can happen if he takes office?
I do think that, if RFK was actually allowed to fully influence through his various appointments and his budget advocacy to really bring to a halt the fundamental infrastructure that is powering scientific research on drug development, that's certainly on the list. But for me, I think probably the scariest thing is just getting to a place where public distrust of fluoride in the water, of vaccines, of these very established pillars of our health system are actually genuinely open to question. I think we're kind of living in this era when, the things that we took as true are under attack. And to me, RFK's potential to really take that to another level and to push his sort of crackpot ideas into mainstream acceptance is probably the single worst thing that I can think of.
Will he face any problems with Trump's whole deregulatory agenda?
I think that Kennedy's positions are all over the map, and there are places where he is pushing for kind of expansive permission. But fundamentally, I do think that his focus on, taking away some of the restrictions that the pharmaceutical industry has placed through FDA and other sources is in alignment with the Trump administration. I think that part of the strategy that will, align with deregulation is taking away rules like the Food, Drug, and Cosmetic Act that have really limited the extent to which, different products can be in the market. So there is a place where Trump's focus on deregulation and Kennedy's agenda do align, and I think those are probably the places he's likely to be most successful.
What about his Make America Healthy Again goal? I mean, is there anything good about what he's trying to do?
Look, I think there is a positive aspect, to his campaign for kind of addressing systemic issues in terms of exercise and wellness. Again, RFK has positioned some of these things as if there was like a conspiracy between the pharmaceutical industry and the government to block people from general wellness. But I do think he could be a positive voice. In the biggest picture, the U.S. health system is the one that spends the most for the worst outcomes. In advanced industrialized country, we have one of the least healthy populations in the world. And that, by the way, that goes across all income levels. And so I think that RFK, if there's a positive to his approach and this Make America Healthy campaign, it would be good to have someone in leadership who would promote preventative health, exercise, diet, and there's more that we could do in that area if we could actually move the needle than any place else. So in that respect, I do think RFK has some positive aspects to his broad messaging.
Last month, Kennedy threatened on social media to fire FDA employees for, quote, aggressive suppression of a host of unsubstantiated products and therapies, including stem cells, psychedelics, some of the discredited COVID-era treatments you were talking about before, and raw milk. I've been hearing a lot about raw milk. What's up with that?
So the raw milk has become a really fascinating issue. You know, RFK has become the huge promoter of it, but the real story on raw milk, there's a whole community, again, generally that's historically been on the fringes that believe that pasteurization of milk is sort of destroying health benefits and that raw milk is healthy. And the FDA has been completely intolerant of raw milk, even though there has been a growing demand for it. You know, by the way, historically, in the era before we began pasteurizing milk, you know, bacteria in milk used to kill thousands of children every year. But what's fascinating is that this issue has really gotten traction, and it seems that a piece of it relates to the Amish community in the Dutch country in Pennsylvania, who were angered in the early Biden administration by a lawsuit that the FDA brought, where they tried to shut down a milk factory that was serving the Amish community and Mennonite community with raw milk. And so the anger was picked up on by some of the Trump activists who went and registered this whole group that had historically not voted, that apparently came out overwhelmingly, if not entirely, to support the Trump campaign. I'm still waiting to find the actual number of how many votes, but I believe it was in the tens of thousands of votes for Trump related to raw milk. So RFK, he's always got that on his list of places where the government needs to stand down, and it's very likely that we are going to see FDA, certainly enforcement, if not actual rules, change to make it easier to produce and distribute raw milk. And it really was something, when we see the actual vote count in Pennsylvania, it may be that the Trump campaign's win there was directly tied to, you know, fighting the government on raw milk. So I expect that will be a sort of significant story to come out of leadership if RFK is confirmed. So
he has no medical background whatsoever. Is that unusual? I mean, what are the qualifications usually for a director of HHS?
You know, we have seen a lot of public health background as a sort of standard. There have been non-physicians who also were important public health leaders. It would be a new thing to have someone who has absolutely no professional background and no training whatsoever in either medicine or public health in this role, and to have someone whose fame in it is really for taking prominently positions as a layperson. So, you know, I don't think this is the only unusual Trump appointment, but certainly we have not seen any PS appointment to Health and Human Services that came so completely out of left field in terms of no connection to medicine, no connection to public health.
And though Kennedy has promised to make America healthy again, there's a picture of him that's circulating on Trump's plane with a McDonald's Big Mac and a Coca-Cola on the table in front of him. He's seated next to a group which includes Trump and Elon Musk. Thanks so much, Harry. That's Harry Nelson of Leech Tishman Nelson Hardiman. Coming up, Trump's pick for Manhattan U.S. Attorney. This is Bloomberg. Donald Trump's plans for the Justice Department have been a lightning rod for months, and his choice of brash lawmaker Matt Gaetz as Attorney General has sparked a political firestorm, probably the most controversial of his picks. But Trump's selection for another top position in the Justice Department is not engendering much controversy. He's tapping former regulator Jay Clayton to be the U.S. Attorney for Manhattan. The U.S. Attorney's Office for the Southern District of New York is one of the most high-profile offices in the country and often called the Sovereign District for its independent streak. The Manhattan U.S. Attorney is sometimes referred to as the Sheriff of Wall Street because the office is famous for tackling complex financial cases. Joining me is Bloomberg legal reporter Ava Benny-Morrison. Jay Clayton, he has no experience in criminal law. Tell us about him.
That makes Jay Clayton an unusual pick to lead the Southern District of New York U.S. Attorney's Office. He was a former regulator. He was the chair of the SEC under the first Trump administration, and he's been a corporate lawyer for a very long time. Most recently, he's been at Sullivan and Cromwell, and he is also on the board of directors for Apollo. But yes, a number of people have pointed out that he doesn't have a history with the office. He's never been a line prosecutor before. And usually veterans of SDNY are picked to lead that institution.
I mean, that is considered the premier U.S. Attorney's office in the country. Being a Manhattan U.S. Attorney is sort of like the top of the pick if you want to be a U.S. Attorney. Tell us about that office.
Yes, exactly. So the Southern District of New York is widely regarded as the most impactful, the most powerful law enforcement office outside of Washington, D.C. The leaders of that office go on to big law firms all over the country. They go on to even more senior roles within the government to lead the FBI, etc. So it is quite a coveted role, and all eyes were on who Trump was going to nominate to fill that seat after his election win on November 5. There was a little bit of anxiety about who would be in contention. I think we have to consider some of the issues that arose in the first Trump administration. That first administration chewed through 2 U.S. attorneys, the Southern District. One, Preet Bharara, was fired along with about 50 other U.S. attorneys around the country when Trump took office. The second, Jeff Berman, he was forced to step down after some ongoing and long-standing tensions with Trump's Justice Department officials in D.C. Berman's actually written a memoir about his time at the office and describes being put under pressure and having to withstand attempts from D.C. to interfere in some of those investigations. So you can understand why current and former prosecutors in the SDNY community were a bit anxious about who Trump was going to name.
Clayton he may not fit the pattern of former SDNY chiefs, but he's not someone who'd be considered a controversial pick. I imagine the prosecutors there wouldn't have any problem with him being the U.S. attorney.
Exactly. After Trump announced that he wanted Jay Clayton to serve as SDNY U.S. attorney, I reached out to a few sources, and the resounding feedback was, we're relieved. It could have been worse. Yes, he's not an alum of the office, which would have given us some comfort, but he is certainly the next best thing. He's well regarded by people at Sullivan and Cromwell in the legal community and by former colleagues at the SEC. I've spoken to a number of people who described him as a talented leader and a responsible regulator. So I think that, even though it's kind of bucking the convention in not appointing someone who has been an SDNY prosecutor before, there is a little bit of relief that Jay Clayton has been put forward for that role. And also people made the point that, yes, he might not have the prosecution experience, but he will more than likely surround himself in the SDNY leadership team with people who are very experienced, who know that office inside out, who have been line prosecutors and who know how their bread and butter work, national security, public corruption, white-collar crime, how it works.
And Ava, Trump had picked him to be the U.S. attorney for the Southern District before. Tell us what happened.
Yes. During the first Trump administration, Jay Clayton was actually put forward as a contender for the Manhattan U.S. attorney position. Now, he didn't get very far because he found himself in the middle of a political standoff between the U.S. attorney at the time, Jeff Berman, and the Trump administration. Jeff Berman refused to stand down, so Jay Clayton could be kind of parachuted into the role. And eventually Berman did step down, but only when he was assured that his deputy, Audrey Strauss, could serve in that position. So Clayton certainly missed out that time, but from what we've heard from people who know him, he has been keen to return to government. This time around, his name had been bandied around as a contender for either the Attorney General position in DC or for Treasury Secretary. So it was a little bit of a surprise last week when Trump announced that he was actually going to nominate Jay Clayton to be SDNY U.S. Attorney.
All the U.S. attorneys resign when a new president comes in. Any information about what the current Manhattan U.S. Attorney, Damian Williams, is going to do?
We don't know what Damian Williams is planning to do. You're right. It's inevitable that he will be asked to leave or resign on his own terms, along with the other U.S. attorneys appointed under the Biden administration. I think there's a lot of interest in what he plans to do next. You know, he's overseen some huge cases while he's been at SDNY, the prosecution of New York Mayor Eric Adams, Archegos founder Bill Huang, not to mention the multi-billion-dollar fraud at FTX. So, yeah, it would certainly be very interesting to see what he chooses to do next.
And Trump has picked two of his personal lawyers for important roles in the Justice Department?
Outside of SDNY, Trump has also wasted no time in putting forward the names of people that he wants to serve in other top Justice Department roles. Among them are his two personal criminal defense attorneys, Todd Blanche and Emil Bose. They represented him during his hush money trial in New York.
And Trump has also appointed the lawyer who argued the presidential immunity case for him at the Supreme Court to be the Solicitor General of the United States. So he's keeping his former defense lawyers employed, is one way, I guess, to look at it. And all these appointees will have to work with Matt Gaetz if he's confirmed as Attorney General.
Definitely. It felt like Matt Gaetz came out of left field. He certainly wasn't in the name of contenders that were being bandied around for the Attorney General position. And it created a bit of heightened anxiety among the SDNY community about who would then be selected to lead this really powerful and impactful law enforcement office. So one of the challenges I think that Jay Clayton will face as Manhattan U.S. Attorney is how he balances that relationship with main justice and with someone like Matt Gaetz, who will be in the most powerful position in the Justice Department. That all said, Matt Gaetz has to get confirmed, at least in theory, by the Senate. And, you know, there are some issues about his history. It's been well reported that he was investigated by the Justice Department for sex trafficking, though charges were never laid. So it's certainly setting up to be quite a colourful and explosive Senate confirmation hearing if it goes down that route.
These Senate confirmation hearings will probably be some for the books. Thanks so much, Ava. That's Bloomberg legal reporter Ava Benny-Morrison.
And that's it for this edition of the Bloomberg Law Show. Remember, you can always get the latest legal news on our Bloomberg Law podcast. You can find them on Apple Podcasts, Spotify, and at www.bloomberg.com/podcast/law. And remember to tune into the Bloomberg Law Show every weeknight at 10 p.m. Wall Street time. I'm June Grasso, and you're listening to Bloomberg.